Okay, I want to thank everyone for being here today, and I want to take this opportunity to welcome our guests from the U.S. Department of Health and Human Services and also the Centers for Disease Control and Prevention to Huntington. We are also honored to have representatives from the State Department of Health and Human Resources with us as well. I want to thank all of you for coming to Huntington to see how we have become, as our mayor says, the epicenter of solutions of the opioid epidemic. I know that our friends from HHS have to leave here at 12:30 so they can be on their way. So we're going to give them an opportunity to have lunch. So we're going to try to be sort of brief here. I'll say a few words of introduction, and then we'll give our guests an opportunity to make some remarks and to react to what they have seen in our city today. At the end, we'll be happy to take some questions from the press, and we'll be available to do one-on-one interviews. So this morning, our guests have visited a number of sites in our city to see how our community is responding to the addiction crisis. I was with them for their first stop at PROACT, and I also believe that they visited Lily's Place, Valley Health, and Project Hope for Women and Children. Our CDC visitors are going to stick around this afternoon and visit the neonatal therapeutic unit at Cabell Huntington Hospital and also see the MOMS, or Maternal Opioid Medication Support Program. Marshall is very proud to be part of these groundbreaking programs along with our community partners at Cabell Huntington Hospital and also in the city of Huntington. None of this would be possible without the leadership of Huntington Mayor Steve Williams and the Cabell Huntington CEO Kevin Fowler. I should also mention that at Marshall we've established a Center of Excellence in Recovery, and we're looking to secure funds to solidify this center with a building and also with permanent employees. We look to be the world's leading university in finding solutions to the opioid crisis and recovery. In the interest of time, I will not individually mention everyone in this room who's played a part in helping us bring all this together and address the crisis, but I want to say that I would bet that each person you see here today has had a part in our successes here in Huntington. Our city collectively continues to be at the forefront of finding ways to address the epidemic that is affecting every community in our state and also in our nation. We've had the privilege over the past few months to host a number of federal agencies who are interested in what we are doing here in Huntington and at Marshall. And I could not be more proud to call this city my home and these people my neighbors and my colleagues. It is now my great pleasure to introduce our distinguished guest, Mr. Eric Hargan, Deputy Secretary of the U.S. Department of Health and Human Services, a position that he has held since October 2017. An attorney by trade, Mr. Hargan has also served HHS as the department's regulatory policy officer, overseeing the development and approval of all HHS Centers for Medicaid and Medicare services and FDA regulations and significant guidances. Prior to this role, he served as Deputy General Counsel. Deputy Secretary Hargan, we are indeed honored to have you with us here today, and I will welcome you to the podium at this point.
Thank you, President Gilbert, for that introduction, and thank you all to Secretary Crouch for you all hosting us here from HHS and CDC last night and today. We're here because this is an epidemic in opioids, and Huntington is recognized as an epicenter of this epidemic. This is an area where the crisis has hit most strongly, and where we believe that the interventions that are eventually going to turn the tide on this are also being developed. And so it is important for us to get out here, those of us who are in HHS leadership, to get out here and find out what we're supporting. We gave $30 million in September through our Substance Abuse and Mental Health Services Administration. And how is that being used? What works? What doesn't work? What are you all finding out when you have to deal most with the crisis at the most intimate level? What that we're funding and what that you're doing is actually being able to turn the tide and bend the curve on this epidemic. President Trump has tasked us with this. He has identified the opioid crisis as really the public health crisis that he wants his administration to focus on. And obviously when the president says focus, those of us in leadership of the department focus. It is reminiscent, as I've said, of my time at HHS under President Bush, where he identified AIDS in Africa as being the public health crisis of that time that he wanted to concentrate on. We now see that millions or tens of millions of people are alive today because of that focus, and we very much hope and expect that President Trump's focus on opioids in the United States will result in that same kind of development of both resources, and Congress has been very generous on resources, on new authorities that we've got because of the passage of the Support Act in the last week, which is going to help us tremendously in this area, and our continuing partnership with state and local people to make sure that we get the programs implemented using these resources, using these authorities, but also making sure that the talents that you all have and the knowledge base that you have is turned into effective interventions to be able to turn the tide on this crisis. This is, after all, a national crisis. It's not, even though it is hit most strongly, and a lot of the most promising interventions are being developed here in West Virginia and in Huntington. We know that this is a national crisis. We are facing the third year of declining life expectancy in the United States because of the opioid epidemic. We have a situation where one single class of drugs is killing more than all drugs killed people nearly 5 to 6 years ago. We have a situation where we have not seen before, where this is not a situation where we have an epidemic infectious disease, but really a crisis within a single class of drugs that's really developed into something that has overwhelmed our system. And this is going to require a lot of thoughtful development of policy, a lot of attention by resources, but most of all, interventions by people on the ground, in their communities, in their families, and in their individual lives to be able to address this, because that is where this crisis is hitting, after all. Some of it is just, when I'm sitting in Washington, I see this many times as you just see statistics, you just see reports, and that's why it's important to really see and have a great deal of interaction with people who are actually doing this and addressing this face to face. So again, thank you all for your hospitality and hosting me and everyone here in Huntington. We look forward to kind of continuing this partnership that we've developed over this time and be able to help you all and then help everyone else, because I think that the lessons we learn here we're going to want to pass on at the federal level to other communities, other states that are suffering as well. So thank you. Thanks very much.
Next up is Dr. Robert Redfield. He's the director of the Centers for Disease Control since March of this year. We had the pleasure of having him visit us earlier this year, and we were all touched by his personal story of addiction in his own family. Welcome back, Dr. Redfield.
I'll keep my comments short since you heard from my boss, the Deputy Secretary. So I do want to say, briefly that the reality is that your community really was ground zero. And I use the word was, ground zero, for the opioid epidemic. And when you try to understand what does it take for a community to come together, and I saw this earlier in my career in the AIDS epidemic when many young people were dying, and finally the community came together because they saw the pain and suffering in the flesh and decided we're going to come together and do something about this. You all have done that. I think when we talk and hear that you're now the center of the solution, one of the things you've heard me say before, that I'd like society to work hard to try to support and strengthen families like my own that are struggling for success against addiction. I think you've created an environment in this community that is beginning to allow the ability to have the environment to heal. And I think you need to continue that, because as was said earlier, the stigma associated with substance use condition, I don't even like the word disorder, I'll keep trying to say that, substance use condition, it's a medical condition. I think you have to begin to get people to recognize it for what it is. It's a chronic relapsing medical condition. And in order to do that, you have to give people the ability to feel supported so that they can have the courage to hope to heal. And I think you've seen this in this community, and this is why I'm so grateful that the Deputy Secretary and others had a chance to come to see it for yourself. So you should be congratulated. You have a long way to go. A lot of us are going to have a lot of hope in what you accomplish because I think the first step is coming together as a community to give people that are struggling to have the courage to succeed against addiction the support they need to do that. So I thank you.
I want to introduce Bill Crouch, who's our Cabinet Secretary of the West Virginia Department of Health and Human Resources. Mr. Crouch has been in the position since January of 2017, and along with Governor Justice, he's been a strong supporter and advocate for the addiction programs and treatment programs that we have here in Huntington. Secretary Crouch.
Thank you, President Gilbert. And I certainly want to start by thanking Dr. Redfield and Deputy Secretary Hargan. The support we're getting from Washington right now is tremendous, and we need that support. I should probably also mention Director Baker, Matt Baker, who's, for a while I thought he was an employee of DHHR. He's around a lot, and we appreciate that very much. I said when I first took this job, it took about 6 months to really get my arms around the drug problem, and another 6 months to realize just how bad it was. And it quickly became a top priority for me and for the department. It's actually one of the first things the governor talked to me about when I first spoke to him about the position. It affects everyone. So we're working hard. We're looking at Huntington as a model. We look to see what works everywhere. Huntington seems to have a knack for making decisions that are good decisions. We're going to work closer with the Huntington folks. We have to beat this problem. It is bringing us to our knees, but we will beat it. It's not a quick fix. It's going to take years. But again, with the support of the folks from Washington, we're in good hands right now, and we have a lot of good folks moving in the right direction. So, thank you very much.